Hi everyone, a very warm welcome to everyone who has joined us today. This Autism Awareness Month, we move beyond labels and report to live reality. So, presenting a powerful and long awaited conversation, which is beyond the diagnosis, a parent's journey through autism. I'm Shweta Mohan, speech language pathologist associated with Walnut Early Supports, and I'll be hosting today's discussion. So, Walnut Early Supports is a simple, easy to use online therapy platform which is created by speech language pathologists to support your child's development. Now, today we have our guest. It's a truly honor to introduce our guest for today. Ms. Milan Singh is a woman who embodies strength, clarity, and purpose both professionally and personally. She is a successful businesswoman, a global trader operating across European and American markets where precision, resilience, and leadership are non negotiable. But beyond her achievements in business, Milan Ma'am most powerful work has been her journey as a mother and an advocate for autism. She is a mother of Singh, who today is India's most followed neurodivergent individual. And when Summer was diagnosed with autism, Milan Ma'am stepped into a journey that was very, she was prepared very slow and a journey filled with uncertainty, learning and unlearning and courage and unwavering belief. Over the years, she has navigated early intervention, education, and transition phases and adulthood, always with a clear focus on independence and voice. Today, Milan Ma'am and Summer are not just raising awareness, they are reshaping narrative of neurodivergence in India. Together, they challenge stigma, question outdated expectation, and show us that neurodivergent individuals can grow into confident adults who influence, lead, and belong. Milan ma'am, we are very deeply grateful to have you today with us. Your journey is just not inspiring, it's guiding, grounding, and transformative for so many families. Thank you for joining us.
Thank you so much. Thank you. Thank you for inviting me on this platform and giving me a chance to speak about it.
Yes, ma'am. Yes, thank you so much for joining. Actually, ma'am, in my everyday work with children and families, there's one thing that I hear over and over again. It's just that they keep saying, we just want to understand and we want to do the right thing for our child. And now we want to understand from your perspective what you know what can be done and what can be done so differently to help our children to go through this phase from the early to their adolescence through their adulthood. So we want your guidance and your lived experience so that you can share it with us and multiple people can be benefited by this. So if it's okay with you, can we start with the first question?
Absolutely, absolutely. Go ahead.
Yes. Milan ma'am, when you first learned that Summer was diagnosed with autism, what was the hardest part for you emotionally? Was it the diagnosis
For
or was it uncertainty for future? Like, what was it?
It was everything actually because I did come to know that he has autism, but I didn't know what autism is. I never heard about this word before. So this was like a surprise and a shocker to me. And because it was too new, and I was also a new mother, so I didn't know how to navigate this journey any further, or is it about like to be like literally? Is he going to be cured? Is this curable? It is just I have to live with it. So that was, yes, of course, hardest part, and of course, any mother would come to know that your child is not as per the normal norms of society. Then you feel bad about it. So that was it, which uh, the first instance was this for me, the very hardest part that I don't know what it is and why me.
Yes. So many parents that I have opted also have told this the fear of labels, fear of what will happen later, and not knowing what to do next has been a very common fear, right? It has been a more common fear that we have seen. Definitely, ma'am. Definitely. So, Uh, so when you have moved from this space, what did you do? Different or what was your first approach towards this? What did you plan on doing at first?
Actually, when I came to know, the first time I came to know about it, I had no clue what am I supposed to do. So I just literally followed doctor's advice and I started occupational therapy. That was it. But later, after that, I really was keen to know what it is. What am I dealing with actually, and what my child is going through. Then I got his proper diagnosis done. And that was the right way of doing it. When you go to a proper neurologist and you talk to them and they tell you step by step approach to understand it, and also, to what path you need to follow.
Navigate to.
That
Yes,
is, yeah, navigate exactly. So that was the first thing which happened with me. Then I was like, all right, now what am I supposed to do? Now I need to learn. Because even doctors were not able to exactly tell you at that time. I'm talking about 21 years back. That
yes,
time, doctors were not able to exactly tell you what it is and how to deal with it. So I started studying. And I think that was the right approach to take care of it because I used to study and I used to keep questioning. So
definitely,
this is what it
definitely.
is.
That time the resources also were very less. I think so. The resources
Yeah.
also regarding this were very less, but that is a great approach to go ahead with. Looking back now, ma'am, what kind of support or understanding would have helped you in the most, the early years while you were parenting? What would have helped you the most, you feel like?
I think I really wish I knew more parents who had child with autism or who have been like speaking the way I am doing it right now. I wish I could connect to somebody because doctors and therapists can just guide you theoretically. They do not know what happens in the house. They do not know how what child is going through 24/7. They do not know all that. Only a mother can tell, because parents can, not just mother, parents can tell because they deal with autism properly whole day. So I wish I had anybody who could have, told me exactly how to go about it. And
Right.
also at that time, there were only few therapies like occupational therapy. I didn't know anything about ABA. I didn't know
Okay.
anything about this new approach of taking care of it. So that was it. I think I wish that I could have been like
So,
introduced to
like
those
more
things.
support from professionals or the more knowledge about professionals, you put it out like that, ma'am? The more the support from professionals
No, I think yes. No, I got proper support from professional whosoever I was in touch
was
with,
attached with.
and also
Okay.
yes. But I wish I knew more. I mean, there were more therapists like ABA therapy. I didn't know. I wish, because Summer has language problems. So if he was introduced to ABA, probably his speech would have been far better
Definitely.
where he is right
Definitely.
now. Yeah.
Absolutely. So the scarcity of the professionals over time was also, an impacting factor at that point. But with that being said, we have, now the recent days, we have digital materials like what we are providing from Walnut Early Supports, by giving parents the opportunity to use it everywhere and anywhere which is possible, from their comfort zone
Exactly.
to any zones to, wherever they travel. It doesn't have to be in a very clinical place, or it doesn't have to be somewhere the child feels like is being questioned or interrogated or is being tested. So that is something I think we have moved from the early decades to now, where we are trying to focus on the children being comfortable in their
Yes.
own space and also learning with the materials
Yes.
which
This
provided to
is
them.
very true. I
Yes,
think this approach has come after COVID. Before that,
yes,
nobody knew that this can be done sitting at your own home and in your comfort zone. Nobody knew about that. So, yeah, parents were going through a lot because you have to take your child to the therapy center every day. It was a torture.
yes,
So,
absolutely,
yes,
ma'am.
things have changed
That
drastically till now.
that is absolutely true. But that is a very good change, right? That is a very great change
Yes,
that we have got.
absolutely.
Absolutely. Great. Okay, ma'am. Next thing is there one thing that you would have done differently as a parent if you look now? There is something that I would have done differently. And if you think so, why? What would it be?
Honestly speaking, I really don't think I should have done anything differently. What what I did and what I'm doing right now, because that is the reason Summer is what he is right now. He's so calm, he's so composed, he's very understanding, and all those things. Maybe because I did something right in my parenting, and that is the result of uh, today's summer.
So
So
if you'll
I
share it,
don't think
what
I
is
should
the
have changed anything.
like the right things that you did? It would be really grateful if you could share that so that we can
Yeah,
learn from that.
absolutely. I would love to. I would want to tell everybody, and that is the reason I started this page, because I want to share my journey so that people can learn through it.
Absolutely.
The one thing which my approach towards Summer or as a child was that I never treated him differently,
Right.
never ever. There were so many challenges, because he never used to look at me. There were like no eye contact. He never used to listen to me. He never used to reply back to me. He had no speech at that time. He was extremely hyper, but I used to treat him exactly the way I would have treated any other child, or the way I was treated in my childhood. you know like doing the house chores, keep talking to him. Even if he would not reply back, I will talk to him as if he's listening, and maybe he's not interested replying, but I never treated him differently, that there's some problem with him or there's something going on. So I
Absolutely.
that was the reason, probably he never felt insecure. He was like, my
Definitely.
mother is confident, that is the reason she keeps talking to me even if I don't reply. So yeah, from then till now, he is very confident child. So I think
Definitely.
that approach which I followed was did wonders.
Yes, that is an absolutely great approach, ma'am. I mean, hats off to you for that. Because what we do in our general society is that we are trying to make them look different, tell that they are different, and we start to treat them different. So what happens is that they go into the space where they are so self-aware and they start, develop some kind of hard feelings telling that, okay, there is something that is different. So they're not treating me
Hmm.
the same way they're treating my sibling or the other child who's, studying with me. So that I think has to be, faded away in a long-term process. But I think that is a wonderful approach that you have made to bring Summer into the place that he is currently a wonderful person. Thank you so much for that.
Yeah, thank you.
Okay. The next one is the what are the supports that you are aware of, ma'am, that are currently available in India for individuals with neurodivergence and for their families to be supported? Are you aware of anything like that at government level or anything on the insurance or financial support level?
I really don't know much, but the only thing which I have recently come to know, which I also want to apply for, is UDID card,
Okay.
which is there. Yeah, that is, but that's, I really don't know how supportive that is, but yes, it is going to help a lot of children to get into jobs, get into Olympic, Paralympics, or that card is very important for everyone, whosoever has any kind of disability, visual or physical or
Anything.
whatever. I mean, yes, anything. They should have that. And if we talk about insurance, then and autism, if we talk about, or neurodiversity, we talk about, then insurance company should not be stopping anybody. I took Summer's insurance and I think I'm fine with it. But a lot of parents have been complaining that companies are not giving insurance because of being autistic. And that is not right, because this insurance company should not give on the physical disability, not on mental. Because autism doesn't need to be get operated or something, that I mean, it's not like diabetes or something that can be cured. It is just developed.
It's not an
So
illness.
I don't know. Yes, so I don't know why insurance companies are creating a lot of problem with parents and the children with autism. That should not be there. But otherwise, I really do not know any other support we have as of now in India.
Okay, okay. Like, what happens is that in the abroad countries, what happens is the therapy sessions and everything are already covered in the insurance, right? So that I think is something that we need to, bring it in India also because the therapy sessions
Yes,
are the most important. And while being, the costing matter, not every aspects of family and every level of family can afford to everything. So what happens that itself brings an hindrance to, the child's development. I feel like the financial part
absolutely.
shouldn't be a hindrance to the child's development, right? That is something that we need to look into.
Yeah, that is very true. And these things should be important and necessity. I mean, but I think we are far away as of now. But I hope somebody or let's vouch for it to with the government that let please start doing it. It's very important for these kids, and the kind of rate we are increasing with neurodiversity, it's very important for them to start giving us support,
Yes,
because not everybody can
absolutely.
afford it, and these therapies are very very important for these child kids.
Exactly, ma'am. That is, I think, that is one place where Walnut only supports, we try to make it as much as affordable for our parents so that they can use it on the regular basis. And, if they're not able to take them to, sessions and everything, at least with the guidance that we provide here with, structured program, we can, give them at least the bare minimum guidance before they go into the proper therapy aspects and they start working into. At least we are trying to lay the foundation over here, and I hope it really,
Okay.
grows into a great place. Yes, for the children that we need.
I really wish this helped parents, because they parents are really struggling with this. Uh, they have to leave their houses, they have to leave their families. Mothers are living with the children in different city, so a lot of family and relationships are getting compromised because of this, and which is not right. So yes, if you can give any kind of support to them, it's going to be wonderful.
Absolutely, because what we are doing is that the parents, both of them are working. So it's not what we cannot stop anybody from doing anything, right? It shouldn't be a hindrance to their own living. So
Right.
the more that we make it comfortable for them to, provide the assistance needed, the better the children and the better the family is. Absolutely, that is
True.
important. Oh, yes, ma'am. Also, I wanted to ask, stem cell therapy is often discussed very commonly among parents for like a treatment for autism. What are your views about that? I just would like to know.
You know that as of now that High Court has already banned stem cell therapy for autism. I'm sure they know why it has been banned, because there was no proof of any recovery from it. And I am the live example. Summer is a live example of it, because even I got to do that. These are like, I mean, I don't know, I shouldn't be using this word, but it's kind of a scam where, everybody's trying to make money through our parents' emotions. Because the moment you tell us that if you will dig a hole right now and your child will be fine, we'll start digging hole. So this is what we do. Exactly. So the moment I came to know about stem cell therapy, I was like, yeah, I have to get it done. And as early as possible. So I did that, and we did 3 sittings. I stayed with summer in Pune, and I did not see much result. I saw results, of course. I can't deny that. But then later I realized, when I told my neurologist told me very clearly, Milan, you do not need to go for stem cell therapy. I mean, me deciding, or some doctor telling me, or my neurologist who is taking care of this autism in and out is telling me not to do it, it gives a sign that they don't believe in it.
You don't
But
believe.
still, a lot of doctors kept vouching for it. So I did, yeah, because I had to do something for my child. So I tried that. And when I did it, for after 3 4 months, I saw all that torture of someone going through so much pain, so much fever. Oh my God, that was a torture. And later, I saw only 5% improvement in him. And when I told my neurologist that this is what has happened, and I've seen improvement, and she literally yelled at me saying, Milan, are you really serious? You stayed with Summer for 24/7 with him, taking him to the therapy, bringing him back, doing therapy with him, spending time. That has given him so much of, improvement. It is not stem cell which has given any improvement. And I actually realized it, and that was a time where I realized that it is totally scam. I mean, people are literally making fool of you by giving these kind of treatments that this will cure your child. Autism has no cure. Your child can improve, but this your child can also improve with a lot of care, therapies at home, outside, and some more developments in the house, I think. So yeah, but a lot of people abroad, they're vouching for it, that they have seen a lot of tremendous changes in the children. I don't know what has made that change, but I really don't think stem cell therapy ever work for anybody. Like 5%, 6% doesn't matter. That improvement you can any which ways get by putting effort yourself. So I really don't know. I have not seen anything, and I will never tell this or recommend anybody, any parent, for their children, because it's a torture.
Okay. Okay. also people are also, watching for medications for autism, medication for curing for autism or ADHD or any kind of, these type of neurodivergent kids. They are trying to, tell that medicine will cure this or any type of neurosurgery will cure this. Are you unaware of anybody else who has taken it? You don't have like anybody else, or you came across somebody telling you that this has worked? Anybody else who's also
I,
looking for these options?
I have heard about medication, but see, we all, as educated society, we should know that autism doesn't have cure. The only medication which you can give your child in recommendation to your doctor is that some behavior therapy, medication, some medication for ADHD, just to help your child to focus on. See, there are so many children like Summer. When he was very young, he was extremely hyper. He would not sit in the therapy, he would not sit in any of his classes. So I did talk to my doctor, and he also recommended some medication, but that is not cure. That is just supportive medication so that your child can sit and attend that therapy, which is going to give some results. So those are the only medication which should be given and should be promoted. Apart from that, there's no medication which can cure, because autism is not curable. It doesn't need fixing, actually. And this is a word which you're saying is neurosurgery for autism. I never heard about it. It's the first time I'm hearing this word.
They're saying that we can, replace some cells and then we everything will go back to normal, or some kind of, surgery to particular part of the brain and they will, cure it. I come across this almost every day, telling that surgery might help, surgery might, better their behavioral aspects and traits and everything. It was very frightening to hear about this, actually, to be honest, because
It is. It is. I mean,
medical people are trying to brainwash people and say that this type of approach is there and we will try to do this, we will try to do that, we will cure autism. Not everybody, but there are few people who are trying to do this, and it really frightens me when I say that they are going forward with it. So almost that is the hardest part of it.
no, but I don't support this. I have never heard about it, and even if somebody is saying you should not do it, because till the time you don't see any evidence of it or you don't see any written papers about it, nobody should believe it. I mean, I know parents are emotional and they go for anything for their children, but this is not right. People are actually extracting all that money from you by saying these stupid things that it is curable is so wrong. You could use that money for betterment of your child by giving better therapies, by giving better infrastructure at home and outside. You can do all that stuff, and you also need that kind of money for their future. So this is totally stupid. Parents should not actually fall for these kind of scams ever. I mean, I don't know. Maybe in future we might come across something which can improve, but as of now,
As of
no, it
now,
is not, and you should not be listening to these kind of any kind of this
definitely.
news.
Thank you so much for sharing with that. Also, ma'am, I wanted to ask about one aspect, is that what do you think about vocational training for individuals with neurodivergence? What are your ideas on it and what are your views on it? Is it important? And when should parents start thinking about it?
It's very important. Vocational training is very, very, very important for these kids, because see, they are every child is different. So if you are a high functioning child and you can take care of yourself, or you're independent and you can learn, then you'll go for any kind of job, or you'll get way of earning money. You will learn that, and you will have money to take care of your life, and parents would not be worried. But children who are like, I would say, Summer doesn't speak, so Summer will never be able to communicate, and will be very difficult for him to get any job. So vocational trainings are going to help them build their confidence and learn some skills, so that at least they find a way to start earning money so that they can be independent. So even Summer is doing it. We started, and you said the age. Uh, Summer did not go to any regular school. I did not send him, actually, because I knew there are restrictions because he cannot speak, and he was extremely hyper. He would not sit in a class of 30 students. He's going to get disturbed, and he will disturb the entire class. So I put him into special school where he learned through one-to-one training whatever best he could learn. But I know he had more potential, but unfortunately we do not have that kind of um, good special schools or teachers who could have trained him beyond his or maybe to his par, to his level. They could have educated him. But anyways, that's fine. I mean, wherever we are, we need to do best for him. So he did his schooling, and after that, when he was 17, I was worried. Now what? Because he's not going to go college. So he need to get into something which he loves also, and he can pursue later. So we started with this bakery because he loves to bake. He loves to cook and all that. So we started his bakery for a year. We ran that bakery. He earned good money through it also. But then, yeah, but then he was a little disturbed and his attention span was getting disturbed. So he did not focus on the bakery. So I had to shut it. But now, recently, we have, he's doing Canva classes. He's learning a course. He's also learning coding. Probably in future he that will turn into robotics if he could do best in this, if he could learn it properly, if he's got skills, then yes, of course, whatever your child is capable of, please put the child into any kind of vocational courses. But please do not fall for those agarbatti making or candle making things, because probably your child has more potential and you're just falling for those simpler things. Don't do that. Try to understand your child's capabilities and according to that choose a course.
Definitely, definitely. I think the prerequisite for vocational is like the pre-vocational skills, which they talk about when they talk about what are the skills that your child currently possesses and how is their behavioral
Yeah,
aspects and how is their cognitive aspects to it. So all this, whenever
exactly.
I suggest some, adolescent person to vocational training, all that they assess is all these type of skills. So I think before going to the vocational training full-fledged, I think it is very important for us to develop the pre-vocational skills, which is such as like the
True.
behavioral aspects and also the cognitive aspects, which is also, very important for their day-to-day life as well as for their vocational training. So in this way, ma'am, we have a module in Walnut Early Supports where it's completely focused on the cognitive and behavioral aspects, where we start teaching about the behavioral and the behavioral traits that they need to possess and also the cognitive skills that they need to possess throughout their life, where they can use all this and they can benefit from this. I think that is like a very wonderful thing that we need to first focus on, and the most important thing that transitions and adolescence from adolescence to adult. I think that is something that is very important, right?
Yes, absolutely is important, and I'm very happy that you guys are there to take care of this. Like before going for a proper course, you guys are there to guide them that what kind of course or what are the capabilities of the child. So yeah, it is amazing.
Also, the last question that I wanted to ask is that, parents are very afraid or they are, still reserved about the topic of fostering independence for their child. They are too scared to let them independent in everything. They, are afraid that what if somebody exploits or what if something happens to them? What if I'm not there at that moment and something happens to my child? So can you please tell me, is there some, strategies that we can, guide parents with so that they can also reduce their stress and also we can foster much more independence for the children so that they can live on their own as much as possible in this society? What would be your inputs or tips for that, if I could?
Yes, I mean, see, even I'm a mother, and these kind of thoughts definitely come to my head also a lot of times. So but you will have to keep that heavy heart, and you will have to do what you have to do for your child, because your child cannot be your baby boy or baby girl for the rest of the life. Eventually you will have to train them for the world so that they can at least go out. I mean, again, and there are different kind of kids who are very independent. They can talk, they can take care of themselves, they can drive, they can ride, they can do whatever. So take one step at a time. But if your child is little more dependent on you, you will have to take a step forward. You say that if you stay scared, you'll never be able to achieve anything in your life, and your child will follow your path. So when you are scared, your child is scared too. So keep your scary heart in your pocket, and just take the first step, because I have done that several times when I was little scared of sending him out of my house also alone. I didn't know how he's going to manage because he doesn't speak. I don't know how people are going to behave with him, what will happen. So one day, one therapist of summer, only she insisted. She said, "No, Milan, you'll have to do it. Let him. Let's just try. What will happen? Let's try." As a fine, I'll do it. Then I used to, keep hiding somewhere and then keep looking at him, how he's going, what is he doing, is he following the path, does he remember the road, what is happening. And then eventually I realized that he's pretty confident. I'm the one who's a fool. I'm the one who's actually restricting him from not going out, because this is my, fear that I don't know what is going to happen to my child. But my child is very confident. So you need to have that confidence in your child, that your child is far more capable of doing things. It's your fear which is not letting them bloom, actually. So please, parents, it's a request that please give them a chance to prove their worth, to be out, so that they become independent and fighting with the world to stay in the world, in the crowd alone. So give them space, please.
Absolutely, absolutely. True words, true words. Thank you so much, ma'am. Thank you so much for those words. Is there anything else that you would like to share with us that we would like to, know about it? Anything else that you would like to tell us? Any tips or something? Or
No,
anything,
I
any
think
few
everything
words,
on.
any words
No,
that you
I think we have covered almost everything, but yes, there are a couple of things which I already said, that this is a major problem with parents. I'm not saying Indian parents or outside or the entire world, but parents have this issue of acceptance. So the day you will accept your child, you need to start understanding that even in your house, when you are guilty of something, when you are sad about the condition, when you are, not being confident about the condition, you are passing on that to your child. And the more your child will see you scared, they will become very uncomfortable and they will not grow properly. They will become frustrated, because they understand, even if they don't speak, they understand that my parents are not confident about me. They are scared about me. They are not happy about me. So that actually make them not very confident adult. And when they reach their adulthood, and with the puberty time and all those things, when the hormonal changes are happening, the aggression becomes more. They are aggressive, they are frustrated, and they start hitting themselves, they start hitting others, they start hating their parents, because eventually they realize that you are the one who are actually hindrance in their growth, because you are not letting them bloom because of your fear. So please keep it aside. Don't let them feel that they have any condition. Just treat them normal, because inclusivity starts at home. The day you start feeling that everything is okay, there's no, different thing which is happening in my house, the day everything will be okay.
Great, ma'am. Wonderful words, wonderful words. Thank you so much, ma'am. Thank you so much for sharing your, journey so openly and honestly. Literally, your story reminds me that autism, or neurodivergence is not a limitation and it's just a way of experiencing a world. Absolutely. So to
Absolutely.
everyone watching today, small and consistent efforts matters. That's what I'm hearing from ma'am's words. Acceptance matters and beliefs matters. So thank you and signing off, ma'am. Thank you so much. Thank you so much for being here.
Thank you so much for inviting me, and
If
this was a wonderful session.
Yes, absolutely, ma'am. It was great talking to you. And if this conversation helped you, please share it with other parents or caregivers. This session will remain available on our page. Feel free to revisit it. Do leave your questions in the comments. We'd like to continue this conversation. So thank you once again, Milana. Thank you everybody for joining us today. Thank you so much.
Thank you. Bye bye.
Bye bye.